everyone, and welcome to our first 2022 industry workshop. My name is Kelly Helm, and I'm NephCure's Executive Director of Patient Engagement. I'll also be your moderator for today's workshop. The goal of today's workshop is to give you a deep look into NephCure's new era of Preventing End-Stage Kidney Disease Act, and give you an opportunity to ask questions about that. So the new era bill is really the culmination of work that started back in 2020 with the Rare Kidney Revolution, in which we gathered patients, healthcare providers, diversity organizations, health diversity organizations, payers, and more to receive input around rare kidney disease, in which we developed a set of high-level recommendations and really a call to action in rare kidney disease care. So over time, these recommendations were formed into the new era bill, which was formally introduced to Congress in April of 2022. And I really can't wait for you all to learn more about this important initiative and how you all can get involved. Before we do that, I would like to let you know that this webinar is being recorded, but it will only be accessed by request for our industry partners. Also, we really want to hear from you throughout the webinar, so please feel free to submit your questions and comments through the Q&A function in the Zoom toolbar, and we will definitely have time to answer your questions at the end of the session. So without further ado, it's my pleasure to introduce to you our two speakers today. First up is Philip Goglis II, who is the managing partner of the Health and Medicine Council in Washington, D.C. Phil has worked with patient organizations like NephCure for many years, focusing on expanding research and educating policymakers on the challenges of the rare disease community. Phil has expertise in the appropriations process and advancing critical priorities of the rare disease community through Congress. Previously, Phil worked for two New York House of Representative members, giving him direct exposure to the legislative process. Phil is a graduate from the University of Maryland, College Park, with a BA in Government and Politics, and received his master's in Public Administration and Master's of Public Policy from American University. He's going to kind of go over the history of advocacy with NephCure. And then after Phil, you're going to hear from Dr. Blair Kaiser, our Director of Government Relations and Advocacy here at NephCure. Prior to joining NephCure, Blair held many roles working in health policy on Capitol Hill and has worked as a biomedical researcher. Interesting, Blair worked as a professional staff member of the Select Subcommittee on the Coronavirus Crisis, where they led a corporate investigation regarding insider trading and financial improprieties, conflicts of interest associated with the leadership of Operation Warp Speed, and the politicization of scientific information. Blair has also worked for Senator Brown from Ohio and has helped craft bipartisan acts for other advocacy organizations in the past. They also spent time as a medical research scientist on several industry and NIH-funded projects focused on developing research and clinical trials to improve the lives of African Americans with sickle cell disease. Blair earns a Bachelor of Science degree from the University of Kentucky and a PhD in biomedical science from Morehouse School of Medicine in 2017. With that, I will now turn it over to Phil to get us started. Thanks, Phil, for being here.
Thank you, Kelly, and thank you all for being here. It's a pleasure to be with all of you. For those of you who I've met before, it's good to be with you again. Those who I haven't met, hopefully we get to meet each other soon. As Kelly mentioned, I'm here in DC as one of NephCure's Washington representatives, and I just wanted to go over a little bit of our history working with NephCure and some of our advocacy successes. So the Health and Medicine Council has been working with NephCure from the very beginning. When NephCure was founded, Dr. Smokler started working with Dale Dirks, who is another managing partner at the Health and Medicine Council here in DC, working to advance critical priorities for our patient communities. What we have focused on over the past 20 plus years is increasing awareness and education among policymakers about our key priorities, whether they're in the House, the Senate, or federal agencies. We focused all of our strategic engagement on relevant stakeholders and decision makers to elevate the importance of research, education, awareness into our specific areas of importance, as well as our communities across the federal spectrum. So our advocacy activities have been very focused on the patient and building community engagement from the local level all the way up to here in Washington. We have had advocacy days pre-pandemic, of course, in person here in Washington, where patient advocates and their families have come to meet with their House member, with their senators, to talk about the importance of raising awareness on FSGS, nephrotic syndrome, IgAN, and other protein-spilling kidney diseases, specifically about increased funding for the National Institutes of Health, awareness activities at the CDC, critical research that's been done at the Department of Defense as well. Our advocates have been trained on the local level to engage with their members during local visits in the month of August or throughout different activities as they come up. Our advocacy days have allowed members of Congress to see firsthand the faces of our patients and the impact that their decisions have on them. Our advocacy day is part of our year-long activity where we engage with action alerts or different points of contact throughout the year, so that way members of Congress are able to really get those key updates about what's going on here for the community and back at home. Also, because of our advocacy days and our engagement with members of Congress, we have developed a large number of key champions who we depend on to advance our critical research. It's no accident that if you look at appropriation bills going back 20 years or so, you'll see mention of FSGS, you'll see mention of ESRD, you'll see specific recommendations for our key priorities at the National Institutes of Health, at the National Institute of Minority Health Disparities, at NIDDK. We are very fortunate as well that Dr. Smokler, who is the founder of NephCure, previously served as a member of the NIDDK Advisory Council. That happened because of our work and our engagement with NIH as a whole, with the Institute, and with Congress as well. We are also very fortunate to have two key members, one in the House and one in the Senate, who have led annual letters for us to be able to advance our critical priorities. On the Senate side, we have Senator Debbie Stabenow from Michigan, and on the House side, we have Congressman Deutsch from Florida. Each year, both have led a specific letter to the Appropriations Committee on our specific priorities, which has highlighted the importance for more research into FSGS, nephrotic syndrome, ESRD, and related conditions to elevate them in importance at the National Institutes of Health. We also have a great working relationship with the leadership of NIDDK, again, with Dr. Smokler serving on the Advisory Council. They gave us a firsthand opportunity to weigh in on critical research opportunities, as well as elevate areas that weren't being focused on at NIH. Those two letters also have led to the continuation of the inclusion of FSGS in the Department of Defense's peer review medical research program. And as a result of being listed in that program, our researchers have successfully competed for over $18.5 million in research funds through that program. That wouldn't happen without our advocates being able to connect with their members of Congress, talking to them about the importance of supporting our priorities, making those connections locally and here in Washington, as well as keeping in touch with them to talk about the critical progress. As Kelly mentioned, a lot of this effort really ramped up in 2020, but I would say that a lot of this really had its genesis when NephCure was founded. And NephCure as an organization made it a key priority to focus on advocacy. Sustained success over the past 20 plus years has increased the research that's being done at NIH, has put NephCure at the forefront of organizations representing our community members. And as a result of those increased research activities at NIH, highlighting key areas of concern, getting new groundbreaking science, the opportunity to meet with the federal agencies to highlight the importance of changing critical endpoints for clinical trials. We have really come a long way to where we were when NephCure first started, or even where we were many years ago when I first started working with NephCure. So while a lot of what I do here in Washington, D.C. is critically important, none of it would be possible without the work of our advocates in our community who are very engaged. You saw one of the pictures earlier in the presentation about all of us. That was our last in-person Hill Day, but our community is very active and very responsive to our action alerts and to engaging with their members of Congress, which have elevated our needs and have put us in a great position to where we are now of the new era legislation being introduced. So with that, I'm going to turn it over to Dr. Kaiser and look forward to answering any questions that folks might have later on. But Dr. Kaiser, I'll turn it over to you now.
Thank you so much, Phil. Hi, everybody. It's so great to be with everyone today, and we really appreciate you taking time out of your day, doing important work, helping advance research and discovery to really aid our patients. So we really appreciate it, and we hope that this hour or so is a good use of your time. As Kelly like to introduce me, I'd just like to say thank you to Kelly for introducing me, but also hi to everyone. I'm Blair. The patients have taken to calling me Dr. Blair, but feel free to refer to me as Blair. I'm the Director of Government Relations and Advocacy here at NephCure, and I really want to talk about this new era of kidney care through NephCure's NephCure Action Network that we have so-called NCAN, and sort of the legislation that we've introduced, how it's involving our patients, how it's giving them new energy and new hope and getting them involved. And at the end, we'll talk about how you find folks can, help us out and help carry this energy forward. And as Phil really said, NephCure Advocacy is accomplishing big things, and we're doing big things with a small amount of people and a small amount of resources. And I've worked here in DC for a couple years now, and I've worked with a couple different organizations, and it's absolutely incredible and sort of awe-inspiring how much NephCure has been able to do before they brought me on board, and how much we've been able to do since, again, with a small amount of dedicated, hardworking patients and a little bit of financial resources. And so over the past couple years, we've been on the Hill. We've been doing our Hill Days, our Capitol Hill Days. This was the last in-person one a few years ago, and Phil and Dale and the folks at the Health Medicine Council have been extremely instrumental in getting us to this point. And we've been listening to organizations, and we've been hosting roundtables, and we've really been sticking in and have stuck our ears to the ground on what the rare kidney disease community needs. And this has sort of led us to our bill, to our legislation that we were so excited to have introduced in the House of Representatives this spring. And that's HR 7506, the New Era for the Prevention of End-Stage Kidney Disease Act. And we were able to get this brought forward through a collaboration or a co-sponsorship between Representative G.K. Butterfield of the North Carolina 1st Congressional District and our Republican co-sponsor, Gus Belrakis, from Florida's 12th Congressional District. So I'd really like to walk you through the legislation, because it really is, quite frankly, a distillation of what this community needs, not only from a patient-centered point of view, because it is when we're all here and we're all working towards new cures and new treatments, because at the end of the day, we care about the patient. But we realize that just focusing on the patient and just focusing on the needs of the patient really can sometimes neglect the research and development infrastructure that is so important on not only the research funding side, but opening up that regulatory framework to really make what you all do a success and get your medicines and get your treatments in the hands of patients who need them. And so the New Era legislation really breaks down into 5 buckets, which I'm going to go through. And I promise this is not going to be super in-depth. This is going to be slightly above Schoolhouse Rock level. So hopefully we can all walk away feeling good about ourselves and that we've understood this and we've gone over no one's head. But it does break down into 5 specific areas. One is establishing a Centers on Rare Kidney Disease Research at NIH. The next one is promoting and creating new diagnostic tools and protocols for rare kidney disease patients and rare kidney disease treatments. The other one is addressing disparities in our communities of color in the country, promoting provider education and promoting that access to specialty care, as well as expanding rare kidney disease research. Am I trying to switch? There we go. So our first bucket is we're expanding, establishing centers on rare kidney disease research at the NIH. And that sort of breaks down into 2 buckets. And we really want to, the first one is that creating that rare kidney disease research center. NIDDK currently, which is the National Institute of that covers kidney disease research, the centers of excellence that they have currently focus on, pediatric nephrology and polycystic kidney disease, but none of those rare kidney disease centers or those kidney disease centers or really any research that has the ability to focus on rare kidney disease research. Sometimes it falls through the cracks or it's completely neglected at all. And so what this would do is our bill would give rare kidney disease research a home at the NIH. And right now we've got that authorized at $4 million per year over the next 5 fiscal years starting this year. And obviously this is a shifting sort of time window depending on when the bill is introduced. And another area that really falls into this, how we want to shape and set the tone for research in rare kidney disease at the NIH is we really want to direct the NIH to conduct a signature genotype-phenotype study to inform rare disease diagnosis. As you all probably know, rare kidney disease is an umbrella term we have for a giant handful of different diseases that all have, they're so heterogeneous. The prognosis really jumps from person to person. And so we really want to really dig in and start to understand each rare kidney disease and how that can inform the diagnoses. And we do have a public and private, this would be funding that would be available for all public and private nonprofit entities. The second bucket within the bill that we want to dive into is that promoting and creating new diagnostic testing protocols. When I talk to patients, and when physicians talk to patients, and when our NephCure folks talk to patients, and we're lucky enough, lucky's a strange term to use, but we're quite blessed that some NephCure staff members who do have children or they themselves are affected by a rare kidney disease. And when you really sit down and you talk with them and you ask them about what do they need, and when we go out into the community and ask our NephCure patient community what they need, they talk about this diagnostic odyssey. And that's what we've used or using to refer to when the patient first has a weird urine analysis, first shows up with a weird blood test, first shows up with symptoms, from that time period all the way through to when there's a diagnosis, and then the diagnosis leading to treatment. And for a lot of our patients, that's a pretty significant amount of time. And that significant amount of time is, time wasted, and wasted time leads to, increased chances of dialysis and the increased risk or need for a kidney transplant. And so our goal is to decrease that diagnostic odyssey, save kidneys, prevent dialysis, and ultimately save lives. And we're doing this in a couple different ways. The first is we want to direct the Department of Health and Human Services to really convene a conference on diagnostic methods for rare kidney disease. And we want to do this mostly because we want to look at the technology that's available, that is currently in practice and common use in the physician's office or in the hospital. And then we want to look at what's in the pipeline, what is being developed by companies like the ones you are here representing. And also what's technology that we need to work for? What is an idea that's on the precipice of being real that may need more funding or may need a little bit more time or a little bit of love and care? And the ultimate goal of this conference is to understand these existing barriers, understand what we need to break these barriers down, and what we can do to leverage all of this together to accelerate the diagnosis, save kidneys, prevent dialysis, and ultimately save lives. We're also, another study we want to do is we want to direct Health and Human Services to conduct a study on early intervention and how that relates to genetic screening. We had a patient summit last month in Orlando, and it was so exciting to talk to different companies who were so kind enough to not only sponsor the event, but to come and talk to patients directly about some of the technologies that they're developing. And a lot of it had to do with genetic screening. I have a child with personally, my personal story, I have a child with a rare disease, and genetic screening has been key to really helping us understand her condition and how we can act early and often to prevent and decrease a worse prognosis for her. And so that's what we want to do here. We want to have HHS conduct a study. How effective is early intervention with genetic screening? What do we need to do to improve it? And if we can improve it, can it improve rare kidney disease health outcomes and improve preventative care for our rare kidney disease patients? And this is going to require consultation with stakeholders and a report to Congress within 18 months of enactment. So we want this data collected quickly, effectively, in a comprehensive manner that we've seen the federal government and the Department of HHS and its stakeholder groups put together. And in 18 months, let's look at the data and let's start to act on it. And for all of this, we've asked for $5 million over a period of 5 fiscal years, FY23 through 27. So it would just be 5 years, not 5 every year. The next bucket is a pretty large bucket, and it's something that I think we're really proud of here at NephCure. And I think it really strikes sort of a bipartisan chord. I mean, I think all healthcare policy should be bipartisan, but here and there stuff falls through the cracks. But this is something especially that, coming from someone who used to work on Capitol Hill, we've seen a strong bipartisan push to really understand social determinants of health and how healthcare differs in the delivery of healthcare and the sort of the lived experience of the healthcare system and the prognoses and how diseases vary between folks really is grim for our communities of color. And NephCure really wants to be at the leading cutting edge of this, helping our communities of color fight rare kidney disease. And this bill has a couple wonderful programs and wonderful initiatives that we have in here. Number one is we really want to create a communities of color service program so that we can offer the nephrologists the opportunity to go into underserved areas and not only to learn about providing care and not only to provide care to these folks so that we can start to rebuild the real dearth of trust that exists between the healthcare establishment and communities of color. And we only know, and we know this through tons of research, not only conducted by NephCure, but across the social determinants of health research spectrum, is that when you have a strong, continued community presence that engages not only the healthcare resources of an underserved area, but also engages the social resources and the social institutions like communities of faith or community centers, that leads to increased quality of care, increased outcome, and early detection of multiple diseases across the lifespan. And so we really believe by establishing these communities of color service programs and getting motivated nephrologists into these communities that we can make a strong difference. We also want to direct the NIH to report on diversity in research programs. And when I say diversity in research programs, a lot of people's first thought is, well, we would just want to make sure that we're giving, not only money to historically Black colleges or universities like the one I received my doctorate from, but what we also want to do is make sure that the research dollars are flowing to individuals, high quality, highly credentialed individuals who are also in these communities. I think we can all agree, and the research backs up this inkling or this knowledge that, the uptake, the trust, the understanding, folks are going to be more willing to work with and get the quality data from these communities when the providers, when your researchers, when your research institutions match not only the sort of racial and socioeconomic mirror of our patients, but also there's a mirror between lived experiences. I grew up in rural Appalachia, and when my doctors understood me and understood what it was like growing up there and sort of understood my individual life challenges, I was personally much more likely to seek out care, to tell them what was going on with me, and be an open and active participant in my healthcare journey with my physicians. And so we really think that sort of idea should match what goes on in terms of diversity in research programs. And I hit on this a little bit earlier, but we do want to specifically provide patient education and fund patient education and referral programs for nonprofits, local agencies, and community and faith-based organizations in these communities of color. The institutions that they interact with on a daily basis and the institutions that they have strong trust in. Let's build out healthcare and rare kidney disease detection infrastructure in those institutions and communities so that we're not having to seek these people out. They're coming to these organizations and these institutions already, and let's sort of use the trust that they've built to build the trust with us and with healthcare providers and with the medical research community at large. We really want to conduct and we're asking them to conduct a study on social, behavioral, and biological factors for rare kidney disease progression in populations of color. I don't have to be the one to tell you all this because you probably already know, but communities of color make up 12 to 13, 14% of the American population given any particular census, but they also on any given day are 25 to 35% of our dialysis patients. So obviously there is something going on socially, behaviorally, possibly biologically in communities of color that is exacerbating and accelerating their rare kidney disease. And we want to get to the bottom of this and understand what those factors are so that we can tailor our research, so that we can tailor our community outreach to target those sort of non-tangible or undiscovered factors to, again, decrease the time to diagnosis, prevent dialysis, and save kidneys. And on the other end of the patient-physician relationship, we really want to promote provider education and access to specialty care. Every nephrologist that I've run across, be they an expert on rare kidney disease or just your general, everyday community nephrologist, wants to do right by their patients. Rare kidney diseases are rare for a reason. Patients are low in numbers, and your average nephrologist isn't going to run into or have to have a deep understanding of these diseases every time. And sometimes that does lead to and contribute to the diagnostic odyssey and that decreased time to an effective treatment. So we want to establish grant programs for hospitals, medical schools, your academic training programs, your T32 grants, public entities, to establish a plan and develop a nephrology training program for primary care providers so that your average primary care provider can have a basic understanding of kidney diseases and rare kidney diseases and be able to spot them in their patient population. We're not asking them to know how to treat them for the rest of their life. We're not asking them to have a comprehensive, deep knowledge of rare kidney disease. All we're asking is that these provider education programs help these physicians be able to more effectively spot the rare kidney disease and then know what to do, what physician to refer them through, what community resource to refer them to, so that, again, we're decreasing that diagnostic odyssey, saving kidneys, preventing dialysis. We also want to establish a grant program for our wonderful public and nonprofit entities to provide that continuing education and training to healthcare providers to help them refer and treat individuals with kidney disease. That could be your local church nonprofit or your local community nonprofit helping connect these nephrologists with the rare kidney disease population in communities of color and across the spectrum of rare kidney disease patients. And finally, we want to cut down barriers and we want to expand rare kidney disease research. And we want to do this in two specific ways. One is we want to require that pharmacy and therapeutic P&T committees, the individuals that determine Medicare Part D coverage for orphan drugs, the drugs that most of your companies are working on and pushing out to aid our population and our patient community. We want to make sure when those coverage decisions are made that there's at least two independent experts who have a deep understanding of rare kidney disease and the medicine and drug that we're discussing so that decisions are made in an informed and timely manner that aid our community and make sure that your drugs, your life-saving medications, get the coverage decisions they deserve and get into the hands of patients faster. And finally, we want to direct the Secretary of Health and Human Services to conduct an experiment. That's a strong word. We want to evaluate models for care for treating rare kidney disease. How can we change the paradigm? How can we change the everyday way that we treat rare kidney disease patients to delay or eliminate the need for dialysis and transplant? We want them to conduct a comprehensive review of those methods, and we want to figure out how to increase public awareness of rare kidney disease, especially in our communities of color. So I've laid a lot onto you, and I've laid a lot of information onto you. I have wonderful packets that I would love to distribute to everyone that has a section by section, that has a simple summary one-pager, that has a more built-out understanding of the funding mechanisms. So you can go back to your home departments, to your government relations person, and really engage them on this, because it's truly a piece of legislation that has something for everyone in this community. So what's next for the New Era Act? Well, right now we've been referred to our committee in the House. We are waiting to see movement on the House, and as Phil mentioned, we are actively seeking a lead set of co-sponsors in the Senate so that we can have it introduced in both houses of Congress. And I really hope that in the next couple of weeks I can share with you that we've secured those partners. I'm optimistic, and I'm not optimistic usually unless I have good reason to be. So more on this to come. Finally, I want to share something that I think, is extremely exciting for us, is extremely exciting for the rare kidney disease community, and I think could be a great opportunity for you all as research organizations to engage with our community and show your support for our community. And that's NephCure is establishing National Rare Kidney Disease this week, or this year for the first time in history. It'll be July 18th through the 20th. We have a packed schedule of tentative events this year. Because of COVID, we will be completely virtual, but it is our hope that next year, and with new vaccines and new treatments for COVID and a safe and secure Washington, D.C., that we can have folks back on the Hill again and give that transformative experience to our patients. But we will be having our Hill Day this year, which we are terming Rare Kidneys on the Hill. There will be an Advocacy 101 training where we take our patients, our patient families, and our rare disease advocates, and specifically train them up and get them ready to be effective, exciting advocates to their members of Congress. We will be hosting, and there will be more information on this in the coming days and weeks, a congressional briefing to sort of tell members of Congress, their staffs, and the healthcare and health policy community as a whole in Washington about this new era in rare kidney disease care. And again, we'll have more information on that. We will be engaging our youth. NephCure has an amazing youth population, not only youth patients, but siblings of patients. And we had our first ever youth summit, which ran in conjunction with our patient summit in Florida in April. And just the youth are engaged. They are excited. They are here and wanting to take the lead and fight for their own lives, and push forward and be an active participant in their care, not only bedside care, but the care that they receive from advocacy. And so we will be engaging them, and it's really exciting to see what they do over the coming years. And we're working on a congressional resolution to really honor this and submit Rare Kidney Disease Week as that third week in July as the premier advocacy event for our rare kidney disease population. So there will be opportunities, and we will be passing this around by email, hopefully at the end of the day. But there are sponsorship opportunities to sponsor various portions of Rare Kidney Disease Week. We do a lot at NephCure here with especially our advocacy department. We do a lot with a fair amount and a little. The work we do is incredible, and I do know that with your help and with your sponsorship of Rare Kidney Disease Week, we could really make this the premier rare kidney advocacy event, and we can touch the lives of patients, and we can touch the lives of those in the healthcare policy community, and really, set the marker down and say, we're here, we're working for our patients, we're working for our patient community, and we're not going away anytime soon. With that, everybody would love to take questions. I would love to engage you. This is my contact information. Feel free to contact me, as it says, anytime. I have an open door policy with our patient and patient families, and I'd love to have an open door policy with our wonderful industry and corporate partners, and so that we can all work together. Again, I say it a lot, but it's true. We want to decrease the need for dialysis, save kidneys, and save lives. And I think we can all do that together. And if you're in the Maryland area, the Maryland, DC, Virginia area, I'm around. I would love to have lunch or dinner with you and talk more about this. And hopefully we'll see you all as sponsors at Rare Kidney Disease Week 2022. So with that, we will all take any questions that you have.
Thank you, Phil and Blair, so much. We do have a couple of questions. Blair, the first question is, can you share what members of Congress are supporting New Era? And I'll kind of join that up with another question. Can you maybe scroll back to one of your slides, or just give more detailed information on the bill, such as the number, and if you're able.
Sure. So right now we have two supporters in the House of Representatives. They're the co-leads of the Rare Disease Caucus in the House of Representatives, Congressman Butterfield and Congressman Bilirakis. We are actively working and have meetings on the books with members of Congress, both in the House and the Senate. When they officially sign on board, I will be more than happy to share those with anybody who wants the information. In terms of detailed information on the bill, the current bill number is HR 7506. Again, we will send around a packet to everybody who's attended today, which will give all the information you could want about the legislation. And then feel free to follow up with me if you have more questions, or if I'm not sufficiently giving you the information that you need to make an effective decision to partner with us on this.
Thank you. I'm also getting ready to share a link for more information on our website about the bill. Blair, the next question is, do you know how many congressional staff will be attending the briefing, and will it be virtual?
So the briefing will be 100% virtual. Yes. As a former congressional staffer, I can tell you that they do get a lot of invites to stuff like this, but we are engaging in a very aggressive outreach strategy to members of Congress and their staff. And as our hope is to have as many people there as we can. We are also going to be aggressively engaging the DC health policy and health equity policy community to try to get as many folks as there as we can, so that this really becomes the yearly event where people come to understand what's going on in our community, how they can become involved, and how they can help. You're muted, Kelly.
Thank you. Sorry. Just if anybody else has any more questions, feel free to submit those to the Q&A. But the last question we have in the queue currently is, do you think the addition of specialists in the approval process can lead to additional legislative initiatives for more engagement in the problems we have in the payer and insurance areas?
I would love for Phil to answer this question for me, but I will just say from my end of the table, again, as a former congressional member of a congressional staff, I think more information and the input of specialists in making informed decisions never hurts a process.
Thanks, Blair. I would echo that. What I do here in DC on behalf of NephCure is strategy and where we want to engage. I am by no way a specialist in any of these approval processes or some of these technical aspects. So I always welcome those levels of expertise to see where we're best suited to use them to advance our critical priorities. So having more information in that would help us in what we are looking to do in terms of how do we leverage that in discussions with House members, with Senate members, and across our activities across the board.
Great, thank you. Last call for questions. Any more questions, feel free to type those in the chat. A couple of things that I would like to mention are we will have sponsorship opportunities to sponsor Rare Kidney Disease Week, and Blair will be following up with a sponsorship packet on that and kind of what that would look like for you all. We're actively working with other rare kidney disease organizations who are also participating in Rare Kidney Disease Week as well. So this is truly part of the rare kidney disease community and not just NephCure. I also included in the chat here a link to all things New Era and really our what we call 365 advocacy program, where you can find the section by section, the bill language, funding summary, a one-pager. Blair will also follow up with this information via email. The last thing I wanted to mention, oh, go ahead, Blair.
I just wanted to hop in and say, you know, we put out the call for this for Rare Kidney Disease Week. We opened the registration up to our community, our NephCure community and the Rare Kidney Disease community this past Friday. And just in under a week, we've had almost 70 registrants for our Hill Day. We're on track to go over 100, and I think that's going to blow our previous participation numbers out of the water. So this really gives you an idea of how engaged and how chomping at the bit this community is ready to engage and advocate for themselves. And anything you all can do in terms of not only your financial support, but your logistical or your any other types of support you can provide are really going to enable these folks to have transformative experiences, not only in their personal lives, but really go to Congress and kick off and make the rare disease community a force to be reckoned with.
Yeah, I love that. I feel like in the past, and having had the opportunity to attend Hill Days in person, I've seen that transformation. It oftentimes takes patients who aren't necessarily activated in their care as much as they could be, and it gives them a sense of ownership, and they go from Hill Day back home and all of a sudden are this activated, engaged participant in their care. They feel like they have something, a voice, something they can do positive in a not so positive situation. So I do feel like Hill Day in particular is one of those empowering opportunities that we provide our patient community. You should now be able to see the link. I'm sorry, I accidentally just sent it to panelists before. So you should have that link in your chat now. And again, we'll follow up with that. The other thing I want to mention is our next workshop is going to be August 23rd, which I believe is a Tuesday at noon Eastern, and it will be a panel, a patient panel. The topic will be around living with rare kidney disease and mental health. So keep your eye out for a registration link on that, but mark your calendars now and save space for us in your busy schedules. We're really looking forward to that. I just, again, want to thank Phil and Blair for all of your hard work over the past 20 years in Phil's case, behind the scenes really, but really impactful work. And we're really excited to move forward with the New Era bill and coalescing a larger rare kidney disease group of folks that can make a difference. So feel free, as Blair mentioned, if you have questions, reach out. And we'd love to get you all more involved. And I hope you have a nice weekend.
Thank you all so much, and we'll be in touch soon.